Good evening. It was a Sunday like no other where thousands of Indians stepped up in the fight against the spread of the highly contagious coronavirus by stepping back, by staying home, by sacrificing their regular weekend routine for the greater good of all, for themselves, because we are all in this together. Thousands of Indians stayed off the streets. They stayed at home after Prime Minister Modi called for a public curfew to curb the spread of COVID-19, which has spread to over 140 countries since it originated in Wuhan in China in December. And while today was a voluntary self-quarantine, it has now gotten official. It has set the stage for accepting stricter restrictions. The government has moved, both state and the central government has moved to go into a lockdown mode, and these moves come on the heels of a review meeting of the situation involving top officials of the centre and the state, where it was agreed that there was an urgent need to extend the restrictions on the movement of non-essential passenger transport, and now only essential services will operate in 75 districts across India that have seen confirmed cases of COVID-19, and several states including Punjab and Rajasthan have announced a complete lockdown that involves the shutting down of public transport, malls and shops. Andhra Pradesh and Telangana have also announced a shutdown, and the national capital, Delhi, has been placed under lockdown till the 31st of March. Part of the imposition of a nationwide restriction to battle the highly contagious coronavirus that has killed over 11,000 people globally and affected over 350 in India. Delhi has now sealed its borders, it has shut its shops, it's allowing the sale of only essential items. The Delhi Metro already announced that it will stop services till the 31st of March, and the Delhi police have imposed prohibitory orders across the city, banning the gathering of more than 4 people.
ये तय किया है आप सबकी सेहत के लिए, हम सबके, हमारी दिल्ली के लिए, देश के लिए ये तय किया गया है कि कल सुबह 6 बजे से दिल्ली के अंदर लॉकडाउन किया जाए और ये 31 मार्च की रात को 12 बजे तक लॉकडाउन जारी रहेगा.
And let's go across. We have joining us on the show today Dr. Randeep Guleria, the director at the All India Institute of Medical Sciences. Thank you, doctor, for your time. It is much appreciated. We know you're extremely busy. Your reaction to these, these huge measures now taken by the government, was this only to be expected given what we are up against?
I think so. I think this is an expected turn of events. Considering the fact that we have now a surge in the number of cases, and we are concerned about a cluster of cases occurring in these areas, and if that happens, then it could spread to other parts of the country. And the most important thing is to prevent the transmission and the spread of the virus. And I think the lockdown is a step in that direction.
So lockdown is a step in that direction, but sir, Dr. Guleria, the WHO's top emergency expert said today that you cannot simply lock down societies to defeat the coronavirus. Eventually, at some point when this lockdown is removed, the virus will grow again. Is that true?
So one should accept the fact that this is a virus which is there to stay. It's not that it will go away. Like what happened during SARS, that the SARS outbreak, the virus ultimately disappeared and we didn't have the SARS virus globally. But the number of cases here in the area involved is much more, and therefore it's likely that the virus will stay on our planet and infect humans for a long period of time. The attempt here is actually not to get rid of the infection, but is to sort of bend the curve. If we have a huge surge of cases, our healthcare, so if we have a huge surge of cases, the healthcare facility will get really strained, and it will be a big challenge to provide care to all these individuals. On the other hand, if we are able to flatten it to the extent that the number of cases coming over a period of time is limited, we will be able to manage that as far as the healthcare facilities of the country are concerned.
So the way to flatten
So
the
I'm not
curve
saying
is
that we
to
will not have
isolate,
cases.
you're saying. Everybody needs to step up to the plate, be responsible towards the community as a large, because it will eventually help each and every one of us. But so given that, yes, so on one hand, the government is pushing for isolation, isolation, isolation. What is the role then of testing? We know that the government has taken the step to move towards opening up the private sector for testing. They've issued those guidelines. That was a much needed step, according to you?
Yes, I think as we move forward with increasing number of cases, and as we start looking at this worry that we may have community spread happening, we need to start opening up the testing that we do. We need to do it in a judicious manner so that it's not misused. At the same time, we need to be able to get some data in as to what is happening to the spread of virus in mild cases, and also in those having SARI, that is severe acute respiratory illness. We don't want to have people who have a severe infection in our ICUs who turn out to be COVID-19 positive and expose a lot of healthcare individuals to the infection. So that is why the guidelines have been changed to really pick that up.
Okay. And lastly, Doctor, you are the director of the All India Institute of Medical Sciences. It's not always that one gets an opportunity to ask you these questions. Many, of course, are wondering now, what can they do preemptively? There are so many, WhatsApps doing the rounds that you can you have to increase your immunity, perhaps take zinc and many other. What would you say that now that we're staying home, what does one need to do to take preemptive care?
So the first important thing is to actually honor this issue of staying at home. Everyone should do that. You keep hearing of people who don't really feel that they can get infected, and therefore they are sort of breaking this quarantine. I would advise every citizen to really consider it in a very serious way. And then regular hand washing, social distancing is also very, very important.
All right. Thank you. Dr. Guleria, for that, for joining us on the show. Thank you for your time tonight. Well, we also have Shamika Ravi. She's a former member of the Prime Minister's Economic Advisory Council. She joins us. Ms. Ravi, first and foremost, this is the two-pronged fight. While we have to, as Dr. Guleria said there, we have to take these very severe steps to stop the spread of this virus, highly contagious virus. At this point of time, it is not without an economic impact. Ms. Ravi, can you hear me? Shamika Ravi?
Sir, I didn't hear any of your question. Could you repeat it, please?
Sure. I was just asking that this government is in a catch-22 situation, because these are some very hard steps that need to be taken to prevent the spread of the coronavirus. But it is going to have a huge impact on the economy. It's going to have a huge social and economic fallout at a time when our economy is already in a very fragile state.
Yeah. Oh, absolutely. That's correct.
Well,
so is there a question? I'm sorry.
Yes, I wanted to talk to you, ask you about the economic fallout of all of this.
Okay. Well, first of all, it's very important to remember that every economy that is faced with this crisis right now has to grapple with the health component of it first and foremost. And of course, given the slowdown and the larger nature of our economy, which means we have a very large informal sector, we have a large number of people who are dependent on daily wages to really make ends meet. The state machinery will therefore have to garner all its strength and capacity to be able to not just stem the declining demand. You have to look at it much more from a humanitarian point of view.
The Prime Minister's speech on Thursday, while of course it has been an excellent speech on the grounds that we saw the results and the response that the people of India had to that today, but there have also been critics who have pointed out that given the huge economic impact of what we're going through at the time when our economy is so fragile, there was no mention in the Prime Minister's speech about how they're going to handle this economic fallout.
Well, Sarah, I think many states have begun to announce. I think, different ministries have started to announce. I think it is a matter of time before we hear something more on this, whether it is going to take the nature of a UBI, what will be the nature of the support, but I really do think it is imminent.
All right. Thank you so much, Shamika Ravi, former member of the PM's Economic Advisory Council, for joining us tonight. Thanks for your time.